It's time for Dr. Joe. Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hi, Ray. How you doing?
I'm doing terrific, my friend. What do you have for us today?
Batten down the hatches and survived that last night. And really for us in the sports medicine world, it was a trial run yesterday of weather. We know that there's a lot of weather coming in the next couple months. We know that in the next 3 months, there's a lot of kids, hundreds of kids in our area that will be out on fields playing soccer and football and JV and freshmen and all sorts of sporting events in high school and youth. And so, what are we going to do when we get into these weather issues? And so it was kind of a trial run. In the high school setting, we've come a long, long way. Again, having experiential knowledge of through the years, it didn't seem like too long ago the officials would talk to the training staff and the athletics department people, and they would actually just look to the sky. You could imagine on a night like last night, looking to the sky wouldn't have been very accurate. And we've come a long way from the standpoint of technology. So I spoke to a couple of my certified athletic trainers again last night, and there are all kinds of different apps that they like to use that give them a good idea of what's coming in weather-wise. So weather-wise, we're going to need to know about how to keep people safe, and we call that kind of the emergency action plan. And really, our teams, our medical teams that are at the schools, should have been out there really in June or earlier to have these action plans down. But remember, we have to keep parents, coaches, players from both teams safe. We have to find shelter for them. We have to find shelter from the wind and tornado warnings. We have to find shelter from lightning. What is really irritating to me sometimes is at bigger venues, bigger events, we'll be covering a game. Most of the games, it's the trainers that are there, and we'll get the players into safe areas, and the spectators and fans will be sitting in aluminum bleachers while this weather comes through, and they won't be moving, and they're not very safe either. So we really need a plan for keeping everybody safe, and that was really tested last night. In the technology area, number two, a lot of our athletic teams and medical teams are saying there's some really good apps. Different people have different apps they like. AccuWeather is a pretty accurate app. WeatherBug is one that several of my athletic trainers really, really like a lot. It helps them a lot. It gives a heat index. It gives a lot of information on lightning and wind and other, so that's very helpful. My trainer, Jeff, at home, really likes one for lightning called My Lightning Tracker, and it gives them the exact distance that the latest lightning strikes are in. And for sports, we have to be at least what's called 5 nautical miles in the state guidelines. That's really about 6 miles away from the lightning before we can start allowing athletes to get back out and talk about playing. So those things are a lot more accurate now as we have better technology. And the officials and the training staff and the athletics departments get together. At most of these events that are going to be going on, there's not always, for sure, doctors and full medical teams. The athletic trainers do a great job with this. Another issue, number 3, is when you've been inside for a while, it's very hot and humid. If you've been in one of those locker rooms, particularly in the sport of football where there are many, many players in some of those smaller locker rooms that were made a long time ago, there's a lot of heat and humidity in there. And a lot of the athletics departments try to get the large fans and even the misting fans to mist the athletes down while they're waiting before they come back out on the field. And then when we look at the technology and we see we're moving toward the all clear and athletes return to the field, one more thing we have to think of that a lot of people skip is everybody's in a hurry now. We maybe have been inside for a while, and it's getting later, and people want to return to the field and return right to play. We need at least a 20 to 30 minute warm up. we really put these athletes at risk if they run right back out on the field and they start playing. And so at least a 20 or 30-minute warm-up. It's a little bit frustrating for the athletes, the parents, everybody, but we have to have them totally warmed up again before they go back, or we're really taking a risk at all sorts of injuries, particularly some of the muscle injuries. So in some cases, if it's been too long of a delay, we'll talk about canceling games, postponing games, or one of the other things that people do, Ray, is the running clock to try to make up some of that time. They'll have a running clock in the second half to try to catch up that, depending on what level that game is at and everything else. So those are about 4 or 5 things that go on that you may or may not be aware of when we have rapid weather changes like we had last night. These storms really move in rapidly, as you know, and we have to be aware of them. And we're so thankful that I get to see us in so much better of a place than we were 10 or 20 years ago.
The idea is keeping people safe, right, Joe?
Absolutely, and a lot, it can be a lot of people when you're thinking about the spectators, the visiting teams. When you're thinking at one venue, there may be 2 or 3 different sporting events going on at that venue at all levels, JV, varsity, freshmen. So, yes, keeping people safe, large numbers of people safe, that all should be thought of in May and June when you're putting together your action plan.
All right, Joe, good stuff this morning and really timely, too. Coming out of last night where that blew in so quickly, and as Joe mentioned, caught a lot of people off guard, but certainly he gave some good insight on what to do, quote, next time. Joe, good visit, my friend. Good talking with you again. We'll do it next week.